So this was the function, and now let's talk about fatty liver disease. What is a fatty liver disease? Fatty liver disease, as the name suggests, is very simple to understand. When your liver starts accumulating a lot of fat molecules in its hepatic cells, then the liver becomes fatty. A lot of fat infiltration in the liver will hinder the basic functionality and performance of the liver. So it usually occurs alongside obesity, alcohol abuse, and other metabolic problems that are associated with poor and unhealthy lifestyle. If it is not caused by alcohol, the condition is called non-alcoholic fatty liver disease, which in short we write as NAFLD, non-alcoholic fatty liver disease. It can also be caused by some genetic factors, some side effect of medicines, or a diet that is high in fructose sugar. So sugar and alcohol creates a lot of load on liver, due to which heavy consumption of high fructose sugar or high fructose corn syrup or alcohol can damage our liver. The most common liver disorder in the developed countries has been associated with insulin resistance. So when we talk about insulin resistance, being a pre-diabetic or a diabetic person increases the risk of having a fatty liver disease. Non-alcoholic steatohepatitis, that is NASH, is a condition that can develop non-alcoholic fatty liver disease, and it can also go worst and convert into liver cirrhosis, which is a fatal disease. So the type 1 fatty liver disease is the alcoholic fatty liver disease, which, as clear as the name suggests, comes from excessive consumption of alcoholic beverages. Let it be whiskey, let it be vodka, let it be wine. Any type of alcoholic beverages is going to create a lot of stress and a lot of overload of work for the liver. Also factoring in that alcohol, the compound alcohol, has a lot of calories also in it. It does not have any nutritious value, but when alcohol is consumed, it actually depletes our body of vitamins and some other minerals also, and it can also interfere in the absorption of nutrition in the GI tract. So a long-term alcoholic has a higher chance of developing a fatty liver disease. So the cycle goes like this. A fatty liver disease is usually the first step in developing even more serious life-threatening disease health conditions such as cirrhosis and alcoholic hepatitis. So what are the main symptoms of developing and after developing an alcoholic fatty liver? So drowsiness, nausea and vomiting. The ability to eat, digest or feel hungry decreases because the liver is not able to perform its function at its optimum level. Fever, loss of appetite, and also it can cause confusion if the liver is not performing well, and there are certain toxic compounds or toxins which the liver is unable to get rid of or eliminate from the body, can cause confusion and slurred speech also. The second type is the non-alcoholic fatty liver disease, in which this condition is more likely to occur with people who have the problem of overweight or are diabetic patients having high blood pressure, hypothyroidism and or high cholesterol, that is dyslipidemia. So this is a general category in which I can say the person is consuming so many calories, okay, but the physical output is very less. So the person is not moving enough but having a lot of calories. So this can happen with a person who is, this can lead to overweight, this can lead to type 2 diabetes, high blood pressure, dyslipidemia. All these problems can become a co-sidelining factor. So in this case also, what are the symptoms that we see? A pain in the upper right side of the abdomen, okay. Swelling of the abdomen, why? Because the size of the liver has increased due to fatty infiltration. Yellow skin or yellowish of eyes, yellowness of eyes. This can be caused when the bilirubin will not be able to filter out properly from the body. Fatigue, general weakness. Why? Because liver is supposed to make all the proteins that help our body in repair and building new cells. So when the proteins will be made in less amount, it will cause weakness and fatigue. visible blood vessels because the osmotic pressure between the vessels can change, and elevated liver function. So all the liver enzymes that we usually check in the blood test will be in a higher range than normal. To confirm a diagnosis of either a person is suffering from a fatty liver disease or not, there are three main options that we have. First is the blood test. Okay, so we just take a blood sample and go through an LFT. So the enzymes that are commonly noted here are called SGOT and SGPT. Okay, these are the liver enzymes. If the liver is fatty, these enzymes will be shown in a higher range than normal in a blood test. The second option is rather invasive. It can be observed that the liver has fatty strands accumulation as seen here in the ultrasound or as seen here in the MRI scan. The third option is the invasive option. Okay, like this, we take a biopsy of the liver and then the fatty accumulation in the liver is confirmed. So if we do have a fatty liver, then what type of treatments do we have on our hand? So what are the options that we have in our hand in terms of treatment? So we can go on a medication that helps with insulin resistance. So even if you're not diabetic, even if you do not have a high blood sugar problem, still to improve your insulin resistance, you will be given medicines that are being prescribed to diabetic patients. And other option, and along with that, you will be given some vitamin E capsules along with some other antioxidants, or you can be put on statins, which are the cholesterol lowering drugs. The surgical treatments for cases that are beyond the reach of medications, some doctors do recommend a gastric bypass surgery in which they cut the size of the stomach. Okay, so this is our regular stomach. Okay, but only this portion of the stomach is left and rest of the stomach is not usable anymore. So directly this small pouch of stomach will be connected to the intestines. So what this will do is this will restrict the person from eating a bulk amount of food. Okay, and also bypassing the starting portion of the duodenum where most of the sugars are being absorbed. But I am not here to tell you about medication or surgeries. So we'll jump into our field of expertise. The things that I want to suggest you is, so how to treat a fatty liver with the help of diet. What can we do when it comes to diet?